This is a scanogram of a 36 years old male patient. Now there are three findings. Please see this malocclusion, enlargement of the mandible. Now this is the mass lesion lying in the nasopharynx. This has resulted in mild to moderate narrowing of the nasopharyngeal airspace. And third finding is the enlarged pituitary fossa. Its dorsum sali is thinned. Floor of pituitary fossa is thinned. There is undermining of the anterior clinoid processes. Now I will show you his CT scan. Now this is the contrast NANS CT scan. Please observe thickened calvarium, suggestive of acromegalic features. Now this is the mass lesion here, lying in suprasellar region as well as left parasellar region and in the pituitary fossa. This has eroded left anterior clinoid process, planum sphenoidale on left side, and this is the dorsum sali. These are the posterior clinoid processes which are also thin. So it's a case of pituitary macroadenoma, which is intrasellar, mostly left parasellar and suprasellar in location. This is the sagittal scan. It further highlights the findings which were present on the axial scan. Now please observe that there is thinning and expansion and ballooning of the pituitary fossa, and it projects into the sphenoid sinus. However, there is no extension of the mass into the sphenoidal sinus. Superiorly, the mass has indented lower part of the left thalamus. This is the bone window. This shows hypocellular both mastoids, bilateral mastoiditis and suppurative otitis media. Myringotomies had to be done on both the sides. Now this is the mass lesion lying along the upper part of posterior wall of nasopharynx and the roof of nasopharynx. Now this is the mass which is lying in the nasopharynx along its roof and upper part of the posterior wall. Its structure is similar to the adenoids. Now please see this mass lesion here. Its texture is similar to the enlarged adenoids. However, since patient is 36 years old, so the possibility of any mass lesion here cannot be excluded and the mass should be biopsied. The most common causes of enlarged adenoids in this age group are the chronic infections, allergy, lymphoma, HIV infections, etc. So a malignancy has to be excluded and biopsy is always suggested in such cases.